Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Prostate cancer. Introduction. Cancer of the prostate is the most common form of cancer that affects men. About 240,000 American men are diagnosed with prostate cancer every year. The earlier prostate cancer is found, the better are the chances of a successful treatment. This patient education program will help you understand what prostate cancer is and how it can be diagnosed and treated. Cancer and its causes. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way as the body needs them. Sometimes cells keep dividing and growing without normal controls, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are rarely life-threatening. If the tumor invades and destroys nearby cells, it is called a malignant tumor or cancer. Cancer may threaten a person's life. Cancerous cells may also spread to different parts of the body through blood vessels and lymph channels. Lymph is a nearly clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer treatments are used to kill or control abnormally growing cancerous cells. Cancers in the body are given names depending on where the cancer originates. Cancer that begins in the lungs will always be called a lung cancer, even if it has spread to another place such as the liver, bones, or brain. Although doctors can locate where a cancer begins, the cause of a cancer in a patient cannot usually be identified. Cells contain hereditary or genetic materials called chromosomes. This genetic material controls the growth of the cell. Cancer always arises from changes that occur in these genetic materials. When the genetic material in a cell becomes abnormal, it can lose its ability to control its growth. These sudden changes in genetic material can occur for a variety of reasons. This tendency may be inherited from parents. Changes in genetic materials may also occur because of exposure to infections, drugs, tobacco, chemicals, or other factors. Prostate Anatomy. The prostate is one of the male sex glands. It is located just below the bladder, the organ that collects and empties urine. It is also located in front of the rectum, the lower part of the intestine where solid wastes are stored. The prostate is about the size of a walnut. It surrounds the urethra, the tube that carries urine from the bladder to the outside of the body. The prostate makes fluid that makes up most of the semen, the white fluid in which sperm travel. The prostate is affected by male sex hormones. Hormones are substances that control functions of the body. The most important male hormone is testosterone, which is produced by the testicles. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Prostate cancer. Diagnosis. Often, early cancer of the prostate has no symptoms. To examine the prostate, usually your doctor will insert a gloved finger into the rectum to feel for lumps in the prostate. This is called digital rectal examination. Sometimes the tumor may be too small for the doctor to feel during a rectal examination. As the cancer grows, it squeezes the urethra. Urine passes through the urethra when a man empties his bladder. That is why the first symptom of prostate cancer is usually difficulty urinating. Note, however, that other diseases can also cause difficulty in urination. The speed at which cancer grows varies from person to person. The earlier the prostate cancer is detected, the better are the chances of a successful treatment. That is why doctors recommend a blood test called a PSA test to help find prostate cancer during its early stages. PSA, prostatic-specific antigen, is a substance in the blood that may indicate prostate cancer. If the amount of PSA in the blood is higher than normal, or if the doctor feels a lump during a rectal examination, the doctor will consider further prostate cancer testing. Some tests help the doctor see the prostate and other parts of the body where the cancer may spread. Examples of such tests are ultrasound, X-ray, IVP, bone scan, MRI. Your doctor may take cells from your prostate and look at them under the microscope. Your doctor will usually do this by putting a needle into the prostate to remove some cells. This is called fine needle biopsy. Your doctor may perform a targeted biopsy using MRI and ultrasound technology. This method allows the doctor to see and access more of the prostate and find cancer in areas where a traditional biopsy cannot. Once cancer of the prostate has been diagnosed, more tests will have to be done to find out if cancer cells have spread from the prostate to tissues surrounding it or to other parts of the body. This is called staging. To plan treatment, your doctor needs to know the stage of the cancer. Staging. If the patient has cancer, it is important to determine how much the cancer has grown and if the cancer has spread to other parts of the body. These two pieces of information help your doctor determine the stage of a cancer. Knowing the stage of a cancer helps the doctor determine the best treatment options. A pathologist carefully analyzes cells and tissues taken from the prostate cancer. A pathologist is a doctor who examines a sample of your cancer under the microscope. Doctors group prostate cancer into 4 stages. The higher the stage, the more advanced the cancer is. Stage 1, or A. The prostate cancer at this stage cannot be felt and causes no symptoms. The cancer is only in the prostate and usually is found accidentally when surgery is done for other reasons. It is too small to be felt during a rectal examination. Stage 2, or B. The tumor is still located within the prostate, but is large enough to be felt during rectal examination. There are often no symptoms. Stage 3, or C. Cancer cells have spread outside the prostate to surrounding tissues, but not to the lymph nodes. Difficulty in urinating is common. Stage 4, or D. Cancer cells have spread to lymph nodes near or far from the prostate or to other organs and tissues far away from the prostate, such as the bone, the liver, or lungs. The patient may experience difficulty urinating, bone pain, weight loss, and tiredness. Treatment options. Treatment of cancer of the prostate depends on the stage of the cancer, as well as the patient's age and his overall health. Your doctor may follow your condition more closely rather than starting treatment immediately. This decision depends on whether you have symptoms, are elderly, have another more serious illness, have only slightly abnormal tumor cells. New advances in medical technology and knowledge make it possible to treat all patients who have cancer of the prostate. Thousands of men with prostate cancer are living longer with less discomfort and fewer treatment side effects. 4 kinds of treatment are commonly used. 1. Surgery. 2. Radiation therapy using high-dose X-rays or other high-energy rays to kill cancer cells. 3. Hormonal therapy using hormones to stop cancer cells from growing. 4. A combination of radiation and hormonal therapy. Sometimes chemotherapy is given when the hormonal therapy isn't working. Surgery can be used to remove cancer from the prostate and from nearby tissues into which the cancer is spread. Surgery is generally recommended during the early stages of the cancer. If prostate cancer is found in its early stages, surgery may cure the disease. Several surgical options are available to remove prostate cancer. One procedure involves removing the prostate through the perineum, the area between the scrotum and the anus. This procedure is called radical perineal prostatectomy. The entire prostate and nearby cancerous tissue are removed. Another radical prostatectomy procedure for removing the prostate cancer and nearby lymph nodes is done through an incision through the lower abdomen. This procedure is called radical retropubic prostatectomy. The radical prostatectomy can be done with the help of a robot, such as the Da Vinci system. During such a procedure, the surgeon makes a few small incisions, introduces the robotic arms along with specialized cameras into the abdomen. Then, from a nearby console, she or he directs and controls the robot to take the prostate. Patients generally recover from this operation faster than with an open operation. Rarely, the surgeon may not be able to take the prostate with the robot and may have to open up the abdomen with a bigger incision. Radical prostatectomy is done only if the cancer has not spread outside the prostate. Often, before this is done, your doctor will do surgery to take out lymph nodes in the pelvis to see if they contain cancer. This is called a pelvic lymph node dissection. If the lymph nodes contain cancer, usually your doctor will not do a prostatectomy and may or may not recommend other therapy at this time. Another procedure, called transurethral resection of the prostate or TURP, involves removing some tissue from the prostate by inserting an instrument through the urethra in the penis. Only part of the prostate is removed. This operation is sometimes done to relieve symptoms caused by the tumor before other treatment, or for men who cannot have radical prostatectomy because of age or other illnesses. Another procedure, called cryosurgery, involves killing the cancer by freezing. Radiation therapy is the use of high-energy radiation to kill cancer cells and shrink tumors. Radiation may come from a machine outside the body, external radiation therapy, or from putting materials that produce radiation in the area where the cancer cells are found, internal radiation therapy or brachytherapy. Because the rays cannot be directed perfectly, they may damage both cancerous and healthy cells nearby. If the dose of radiation is small and spread over time, the cancer cells die while the healthy cells are able to recover and survive. Radiation therapy usually is given for prostate cancer that has not spread to other parts of the body such as the lungs and bones. Radiation therapy may also help stop the cancer from spreading further. Radiation therapy may cure the disease if the cancer is in its early stages. Radiation therapy may also relieve pain if the prostate cancer has spread to the bones. Hormonal therapy is the use of hormones to stop cancer cells from growing. Male hormones like testosterone can help prostate cancer grow. To stop the cancer from growing, the patient is given medication to decrease the amount of male hormones. Examples of such medications are female hormone therapy, LHRH therapy, anti-androgen therapy. Sometimes an operation to remove the testicles, orchiectomy, is done to stop the testicles from making testosterone, the main male hormone. Hormone therapy is usually used during advanced stages of cancer, when the cancer has spread outside the prostate or to other parts of the body. Hormone therapy does not cure cancer, but can slow its growth, helping extend life and relieve symptoms. Chemotherapy is the use of toxic drugs to kill cancer cells. Chemotherapy may be taken by pill or may be injected into the body by a needle into a vein or muscle. With chemotherapy, the drug enters the bloodstream, travels through the body, and kills rapidly growing cells, which include cancer cells and healthy cells. To destroy cancer cells without seriously harming healthy ones, the drugs are given in certain dosages over time. To date, chemotherapy does not work well in many men with prostate cancer. When it is used, chemotherapy is limited to certain advanced stages of prostate cancer in which the cancer has spread to other parts of the body. Biological therapy, which uses your immune system to fight the cancer, may help. In this type of therapy, a doctor removes some of your stem cells, modifies them in a laboratory, and places them back into your body. Biological therapy can be effective, but it is also expensive and can require many rounds of treatment. After treatment, prostate cancer may come back or recur. The treatment option for recurrent prostate cancer depends on several factors, such as the stage of the cancer, what treatment the patient had before, and the health of the patient.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cancer of the prostate is the most common form of cancer that affects men. Regular screening helps detect prostate cancer in its early stages. If prostate cancer is detected, several treatment options are available. The treatment depends on the stage of the cancer as well as the age and medical condition of the patient. Thank you for using Explain.